Hello everyone, this is Dr.Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss all about week 5 of your pregnancy. This is going to be a series where we are going to cover each week by week in detail so that you know what is going to come ahead of you and you're going to get yourselves prepared. Let's get started. So it is just 1 week after your missed periods. You are very curious to do your urine pregnancy test or an ultrasound scan. Mostly, urine pregnancy test is usually recommended after like 6 weeks to have a safer bet because the chances of positive result is much higher. But many women can have positive UPT even after 3 days or 5 days or even a week after their missed periods. So if you want to do a urine pregnancy test, just go ahead and do that test. But if it comes negative, please don't be disheartened. It can be little early for testing. So do repeat the test after 7 to 10 days. Always use early morning first urine sample because that's going to be loaded with beta hCG than the rest of the day urine sample. And if you want to do an ultrasound, be prepared that it can be again little early for you to do the ultrasound scan. Usually doctors recommend ultrasound scan at 6 to 7 weeks in order to see the cardiac activity which also appears by that date, as well as the gestational sac, yolk sac and the fetal pole. But if you are doing the ultrasound scan by this week, that is week 5 of your pregnancy, what you could see, you will be seeing a rounded structure which is called the yolk sac, and inside sometimes you can also see an embryo. If not, please do repeat the scan after 7 to 10 days to see the embryo as well as cardiac activity. If you don't see cardiac activity, the baby's heartbeat, do not get afraid. This is too early for a scan. So do repeat the scan. You will always find the heartbeat in a range of 6 to 8 weeks. So by next scan, you can definitely see a heartbeat. So what is happening with your baby? Your baby is too tiny for a seed size. So your baby is now like a flat disc with 3 layers. The top layer is going to get formed into brain, nervous tissue as well as the skin of the baby. The middle layer, that's going to form the lung and intestines of the baby. And the third layer, that is going to form the rest of the organs like heart, external genitalia, kidneys, etc. So what are the symptoms that you can face in week 5 of your pregnancy? You can feel tiredness, nausea, morning sickness. You don't feel like getting out of the bed. You feel all lazy and body pains can be there. You can also have frequent passing of urine because the growing uterus is pressing against your bladder, causing you to pass urine more frequently than normal. And you can also feel other symptoms like constipation, mild lower abdominal pain. What are the red flag signs? Spotting or bleeding can be alarming to the mother. First, it can be a normal spotting which is called implantation bleeding, which is nothing but the baby which is just getting formed, which is the fertilized ovum, is now getting implanted into your uterine cavity, because of which there can be shedding of some layers which can lead to mild spotting. Usually the spotting or bleeding in implantation bleeding doesn't exceed few drops, but do consult your doctor to make that check ultrasound scan to see if the cervical os is closed as well as if the baby is doing fine. Abdominal cramps is one normal thing that you can experience during this phase. This is because of the growing uterus which is stretching a bit, because of which you could feel that vague dragging sensation or pain. But if the pain is severe, if it is consistently present or if it is localized towards one side, then make sure you rule out ectopic pregnancy. Do consult your doctor for a check ultrasound scan to rule out ectopic pregnancy. As I told earlier, as this is a very early phase, there are chances that you can even end up in a miscarriage. What are the signs of miscarriage? If you experience severe abdominal pain along with mild spotting or bleeding, or if you're facing severe giddiness, do reach out to your doctor for a check ultrasound scan. And some women can also experience severe vomiting, which is called hyperemesis gravidorum. So if you experience severe vomiting, like you take anything, immediately you throw up, then definitely you have to reach out to your doctor so that your doctor can manage you better with IV fluids and other medications, so that it doesn't take a toll on your health as well as on the baby's growth. I hope you found this video useful. If you like this video, do like, comment and subscribe to my channel and press on that notification bell icon so that you don't miss out on any new videos in my channel. Until I meet you in the next video, stay happy, stay momified.